Welcome to the course's conclusion. This is the 9th of 10 modules. This module reviews the course's key points and tools and discusses next steps to address the healthcare transition in your school. This course began with a description of the healthcare transition and its importance. Successful transition to adulthood depends on a successful healthcare transition. This course highlighted specific concerns for youth with special healthcare needs throughout the healthcare transition. Throughout the course, we identified key strategies and concepts for working with parents and caregivers during transition. Module 2 illustrated how transition and adolescent development progress together. Module 3 focused on the differences in transition between the healthcare community and educators. Keep in mind that healthcare transition is essential to the success of your existing transition services. Module 4 presented information and tools for students to maintain continuous coverage during transition. Module 5 identified legal and financial considerations during transition, including decision-making support, vocational rehab, and Social Security. Module 6 focused on assessing healthcare transition readiness and healthcare skills. Healthcare transition assessment integrates with and supports existing special education evaluations. Use these tools to your benefit when preparing for the student's transition plan. In Module 6, we covered the development of healthcare skills by creating a transition plan with students to address 1 to 3 skills. Module 8 provided information on the care transfer. This section reviews resources from the course and provides links to the tools from each module. Bookmark the Florida HATS website for quick access to the latest news and tools on transition. Here are links to specific Florida HATS tools used in the course. GotTransition.org is the official website of the National Center for Healthcare Transition Improvement. This slide contains all of their tools referenced during the course. Resources on adolescent development include tools for the 3rd edition of Bright Futures, tools to develop the student's self-efficacy, and a guide to discussing sexual health with students who have developmental disabilities. Tools for maintaining insurance during transition include the Florida HATS Insurance Guide for Students, resources on the Affordable Care Act, from Medicaid, and for private insurance. Tools for maintaining insurance during transition include the Florida HATS Insurance Guide for Students, resources on the Affordable Care Act, from Medicaid, and for private insurance. Addressing financial considerations during transition focused on resources from vocational rehab and Social Security. Module 5 also gave resources for students who will need decision-making support after turning 18. Use these tools to assess students' healthcare transition readiness. To integrate healthcare skill development into the IHPs, 504s, and IEPs, use these tools. Use these tools to support the student during their transfer to new adult-oriented providers. Access the tools on this slide in the course toolkit. Links to the tools listed on this slide are accessible via the Florida HATS website. The following slides describe statewide efforts to improve transition care. Join us in improving care for transitioning students. Connect students and families to the wide range of educational materials and resources available on the Florida HATS website. Sign up for the mailing list to keep updated on important transition issues and upcoming events. If you live in one of the regions that have formed a transition coalition, consider joining them to improve your local system of care. Most importantly, become a transition champion by working within your own school to educate and advocate for policies that support improved transition care. The next module provides the offline continuing education activity.